Hello, everyone. So it is 11 a.m. Pacific time, so we will go ahead and get started. My name is Nicole, and I'm going to be your host today. We're so happy you're here. For those of you who've just signed on, please give us a shout-out in the Q&A box and let me know that you can hear me okay. While you're doing that, I'm going to take care of the introductions and housekeeping items. We're scheduled for 60 minutes with 10 to 15 minutes of Q&A at the end. We encourage your participation throughout the session, so please don't be shy. The Q&A box will remain on your screen throughout the presentation, so please type questions in there anytime. Also, if you're having any technical difficulties during the session, you can seek help in that box. Our team is here to help you. We'll be sending out the recording via email today with CE info, and we'll be posting recordings daily in the Facebook group. Our goal is to offer CE credit for these courses. The evaluation and quiz will be sent today, and your CE certificates will be issued within 1 to 2 weeks. All right, so with that out of the way, I'm very excited to introduce our presenter, hygienist Kelli Jaecks. Kelli Jaecks is the owner of Kelli Jaecks Verbal Impact, an educational company whose mission is to empower people to optimal health through education and entertainment. She is a nationally published author, speaker, and blogger on a variety of healthcare-related topics in the arenas of women's health, cannabis, overall health, and leadership. Kelli, we know you're an incredibly dynamic speaker, and we're thrilled to have you here today. We also have Dr. Cooch joining us. He's the founder of Carry Free and an internationally recognized speaker. He has published hundreds of papers in dental and medical journals, and we are lucky to have him as our resident Carrie's risk management expert. Dr. Cooch, would you like to officially hand it off to Kelli?
Oh, yes, I would. Kelli, you are absolutely one of my favorite people in the world, and we go back a long time. I'm not going to say how long because don't want to embarrass us about our ages, but I've known you for so long, and you are such an inspiration and such a dynamo in our profession. You have done so many different things, and you're an expert on so many topics, and I just adore you. And on top of this, what you didn't also learn is she is a terrific dancer, and she also does small theater. So she has some talents that we haven't, seen directly in the dental profession. But Kelli, it's just my pleasure to introduce you and invite you today. So take it away.
Great. Thank you, Dr. Cooch. Hello, everyone. Thanks for joining us today for Cannabis and Inflammation. I hail from the great state of Oregon, and in this state, we legalized recreational cannabis in 2016. So when that happened, I, as a healthcare educator, said, I better start researching this topic. And since then, I have spoke on cannabis all around the country and on various different aspects of cannabis. So thanks for joining me today. Thanks, Carry Free, for having us. You have seen what we're going to talk about a little bit in this fast and furious hour. And some of the basics that I always need to cover when I talk about cannabis is we have to look at the differences between THC and CBD. Those differences create incredible changes in why people use, what people use, and what they use cannabis for. And of course, today we're going to focus on the anti-inflammatory properties of the cannabinoids that are in cannabis. And we're going to touch a little bit on terpenes as well. This is new science emerging around cannabis. And then, of course, we have to look at how does cannabis work in our brain and body. And we'll be ending by looking at a little bit of what's new even in the dental arena around cannabis. So thanks for coming on this journey with me. You can connect with me in any of these spaces. But in 2016, when Oregon legalized recreational cannabis, my husband and I had some guests that came to our home. It was legalized in July, and these guests came in December over the Christmas holidays. And they said, Kelli, we want you to take us to a pot shop. And now, mind you, I had never been in a pot shop before then. I was not a medical marijuana user. And so it was all new territory for me as well. As we walked into these double doors, everything was darkened. At that point, you had to put your name, your driver's license number into a database. I was kind of freaking out, right? because of where we've come in our cultural shift. I probably, like many of you, was raised on, the war on drugs and DARE programs, Just Say No, and that marijuana was a gateway drug. So that was all kind of scary for me. As we get started today, I want you to have this website in front of you, kellijaeckscoaching.com/cannabis. This is a separate handout I've created for you. It's not the handout that you'll be getting at the end of the hour today, but I have made the ultimate cannabis cheat sheet for you. It's about 6 pages long. It's wonderful to have chairside when you get back to your practices, and or just have for quick reference at your home. Perhaps you have teenagers or you have other people in your household that might be interested in cannabis. So the ultimate cannabis cheat sheet is free for you. Go to kellijaeckscoaching.com/cannabis, put your name and email, and you can download that. So because we're talking about inflammation, I have to do a very, very brief review. All of us know this already. If we are in healthcare at any level, we know what inflammation is, that the purpose of inflammation, of course, is a normal response to harmful stimuli or injury to the body, right? So inflammation might happen if we have a physical wound, we fall down, or we cut ourselves making dinner. That would be the inflammatory response would happen. If we have a bacterial infection or a viral infection, then of course inflammation would be set up in our body. So inflammation is, we have two different kinds, self against non-self. So that's when we have the inflammatory response to a physical injury, bacterial or viral. Those are all non-self. Or self against self, and that's when our inflammatory response turns to ourself, and where we have those autoimmune diseases. Those are all inflammatory, self against self. So what are the 4 cardinal signs? Just to review: redness, heat, swelling, and pain. Why does this happen? Because, of course, the inflammatory mediators are going to town. The inflammatory cascades are happening molecularly, and we have dilation of our blood vessels, which brings the redness to the surface. We have a ton of localized tissue metabolism happening, which is why we have heat. It's why we have fever. It's why if you touch a wounded place, you're going to feel heat. Swelling, right, because all of the molecular dilators are moving in, the fighting cells, and so your vascular fluid, you get a whole lot more vascular fluid because of these cells, and so that's how we get the swelling, and then of course the pain. And now we know, those of us in dental, the greatest disservice that whomever's in charge of making this human body is that periodontal disease usually doesn't have pain until we're at the very end stages. Okay, so that's the cardinal signs. What do we know? We all know on this call a ton about periodontal disease. This is not a review of periodontal disease. But what do we know? Our prevalence is very high, particularly in the United States. It's estimated by the Journal of Periodontology that over 50% of those over 30 have some sort of periodontal infection. So you see the millions there, 65 million almost. We know that periodontal disease is an inflammatory disease. I was in dental hygiene school in 1996 at Oregon Health Sciences University. When I graduated, we were not talking about periodontal disease as an inflammatory disease. But today, we know that it is. And that is caused much by bacterial pathogens, by the inflammatory response, and of course the host response. What else do we know about inflammation? Well, inflammation is the foundation of all disease. So whether we're talking periodontal disease or cardiovascular heart disease, whether we're talking obesity, cancers, all cancers also are inflammatory diseases. So inflammation is a huge, huge driver of not only health when we need to have the inflammatory response to clean up a bacterial or viral infection, but when our inflammatory response is nonstop, then we have setting up of many of these disease states. And so to find ways to reduce inflammation in the body is going to help us whether we're talking oral or whether we're talking systemic. We have got to reduce inflammation in the body. Now, inflammatory mediators, these are some of those action items that come into the blood vessels that come to work when we have an acute inflammatory need, right? All of these, macrophages, interleukins, C-reactive proteins, they all play a role in all other systemic diseases as well, whether we're talking heart disease, rheumatoid arthritis, etc. If you have any of those inflammatory disease states in your body, you're going to see increases in these mediators in the blood. So it's not just we see these in active periodontal disease, but we also see these mediators in any other systemic inflammatory response. And so when you break it down, all this science has come out in recent years about periodontal disease affecting other systemic health diseases. It all comes down to basically two ways that perio affects the systemic health. The first way is the periodontal pathogens themselves, the bacteria that periodontal disease comes from. We know that those bacteria travel through the blood system. They set up shop in different areas of the body. And so that's how one way that periodontal disease affects systemic health. The pathogens themselves and those bad boys travel around and do damage, whether you're talking about a joint, whether you're talking about the brain, whether you're talking about metabolic syndromes. Then I have the troops up here because those mediators are what I call the inflammatory troops. The inflammatory mediators come in, the troops come in, and again, if it's not resolved in an acute manner, then it becomes a chronic inflammatory response, and those mediators, although they are trying to do good, they also can have very deleterious effects on the body. So that's really two ways. The pathogens themselves and the inflammatory response itself is how all of those diseases are connected. So now we're going to turn our attention to the cannabis, from the dental world to the cannabis world, and take a look at some of the basics that we need to know when we're looking at cannabis. People say, well, what's the difference between marijuana or hemp? What do you mean THC versus CBD? Pot, what is pot, right? So here are some basic definitions of cannabis. Now, when we say marijuana, that's used to describe cannabis with THC. What is THC? That's the psychoactive component. That's a component of cannabis that makes a person feel high. So if cannabis has over 0.3% THC, it's considered marijuana. So you have the THC, then you have CBD. That is the non-psychoactive component of cannabis, right? CBD will not make you high. CBD does not show up in blood tests. CBD is very different from THC. Terpenes, what are they? Well, cannabis has over 200 terpenes, and they're really the essential oil of the plant. Okay, so you know that smell? If you see someone smoking a joint, you smell that marijuana, that smell comes from the terpene in the plant. And we're going to take a look at terpenes a little later, and they're very actually common to us. It's just that we never really have thought about terpenes in cannabis. They're responsible for that odor. And then hemp. Hemp comes from the sativa strain of cannabis, and from hemp it can be made into hemp oil or CBD oil. Now hemp oil and CBD oil is free of all cannabis. So, hemp oil is free of all cannabis. CBD is a cannabis oil. So it helps to know a little bit of the definitions, what we're talking about going forward. And I like this slide because it really explains a little clearer. Cannabis is the genus of the plant, so everything is under the umbrella of cannabis. The two strains we talk mostly of are this pink one, indica, and the blue one, sativa. You can get marijuana. Remember, marijuana has over 0.3% THC content. You can get marijuana from both the strain of indica and the strain of sativa. Hemp only comes from sativa strain, and CBD oil is extracted from the hemp plant, as is hemp oil. So I find it very educational to find out where all this stuff comes from, because it depends on, when we're looking at legality across the states, everything depends on, does it have a THC content and how much content does it have? So I asked you a question. Does the state you reside in have legal medical marijuana? You could put it in the chat if you like. If you know, yes, no, don't know. And I have a lot of yeses, I have some no's coming in. Good. It's good if you know. If you don't know, I'd encourage you to Google it and find out what your state is doing. Then, how many in this audience have legal recreational marijuana, which is different? There's about 33 states right now that have medical legal, and only about 11, plus Washington, D.C., that has recreational. And then we don't have time today to get into hemp, but hemp is a whole another issue since the 2018 Farm Bill passed. Okay, we had a lot of no's with the recreational and with the yeses. And then there's other counties and cities that are decriminalizing marijuana, but that's also a different issue. So I want to look at how does the cannabinoid receptors work in our body. We have cannabinoid receptors all through our body. I did not know this until I started researching this, but hundreds of tissues within our body. And our body makes cannabinoids. So when you take in a cannabinoid through cannabis, it's actually acting on these receptors that we already have in the body. So we have two different kinds of receptors, CB1 and CB2. The CB1 receptors are in really high levels up in the brain and in the spinal cord, and lower amounts of these receptors are throughout the body. CB2 receptors are mostly found in our immune system, along the digestive tract, and some in the brain, but not as much in the brain. And marijuana itself contains over 100 cannabinoids. And with this system, that's just interesting to note how it can work for us. So when you look at a picture of the brain, we are all familiar with the brain from our anatomy and physiology. And there's different, in the brain, there's all these CB1 and some CB2 receptors. But you think, well, why would people want marijuana or want to take cannabis? Well, for instance, let's just look at the brainstem. The brainstem is what controls, in our human body, nausea, vomiting. It's a chemoreceptor trigger zone. A lot of peripheral sensation comes from the brainstem, and pain. So if a person is suffering with nausea and vomiting, perhaps they're taking chemotherapy and they can't eat, they want to eat, then they might want to take a type of cannabis that's going to affect the brain and the brain stem so they can have some relief from those symptoms. Whereas you look at the hippocampus, and what that is really responsible for the brain, as an example, is learning, memory, stress. So if you have a person who's highly stressed or anxiety-ridden, they might want to take some kind of cannabis that's going to really go into those receptors within the brain and the hippocampus so they can have some relief. The brain is awesome and very interesting, and the cannabinoid receptors are alive and well in the brain. This is a great picture of where our CB1 and CB2 receptors are. And here's what's interesting. The CB1s that are mainly in the brain and the brain stem, those are the receptors that THC, the psychoactive part of cannabis, bonds to. The CBD, the non-psychoactive, really enters into these receptors of the CB2, which are more in the immune system and more peripheral on the body. So I have had people ask me, well, why would anyone take THC? Well, you might want THC if you're suffering from depression or anxiety or PTSD, because that's the kind of receptors, the THC receptors are the ones that are going to work on the brain more than the CBD or CB2 receptors. So let's take a look at what is some of the research saying about inflammation and cannabinoids. Well, over a decade ago, we knew that the CB1 and CB2 receptors have found on immune cells, and that suggests in itself that cannabinoids can play an important role in the regulation of the immune system. Okay, just basic science. Then we know from research that was released in 2018 that the cannabinoids do act on the immune function, which triggers anti-inflammatory actions, which often we want. And then cannabinoids can trigger robust immunomodulation, right? They can alter those cytokine levels. Remember that cytokines are one of those inflammatory mediators. They can kill the lymphoid cells, and they can induce suppressor cells of the immune system. So that might be good, maybe if you're looking at something that you do need to suppress in the immune system. So this is just a few of the research, and I have it in my slides that if any of you want my citations, just email me and I'll be happy to ship off that page for you. I want you to meet Dr. Sue Isley. She is the lead researcher at the Scottsdale Research Institute, and her work focuses right now on PTSD in veterans, and she has been studying cannabis for years, and what she's come to find out is that, yes, indeed, cannabis does dampen the pain pathways in our body, and that it has something to do with the peripheral nervous system. Because of marijuana and how we all were grown and the culture we've had in this country, we think of marijuana as focusing on the central nervous system, the brain, the spinal cord. But actually, we're finding that it also has a lot to do with peripheral nervous system. She's found evidence about coupling between pain receptors and the endocannabinoid receptors, and also that the endocannabinoids can act on different stages of the inflammatory process, and the cannabinoids will act in response to tissue injury. So her research is pretty groundbreaking, and she is, like I said, doing research with PTSD veterans. I also want to introduce you to Dr. PRAKASH NAGARKATTI. Now, this gentleman is the Vice President of Research at the University of South Carolina, and he oversees $250 million of research enterprises across all their campuses. But he's the director, get this, of the National Institute of Health Centers for Research Excellence in Inflammatory and Autoimmune Diseases. Okay, so that's what he works in, inflammatory and autoimmune diseases. And he has been, over 20 years, he has been considered our nation's leading researcher into the possible medical uses for cannabis. So this guy has a full body of work. I just pulled out a couple of things for us to look at today. But he has found that THC, which is the psychoactive part of cannabis, can suppress the immune system, and he thinks that brings a lot of hope in research for autoimmune diseases. He's looked specifically at multiple sclerosis and how that cannabis, THC and CBD together, a blend, can reduce neuroinflammation. So that's pretty groundbreaking when we're talking about medicine in marijuana. And I would like to say that many people labor under the assumption that medical marijuana is only CBD, and that is not true. Most medical marijuana is a blend of some THC and some CBD. And people who use medical marijuana usually are aware of how much percentage of THC versus CBD is in the products that they use. But Dr. N says this, that the cannabinoids in marijuana present us with a double-edged sword, right? On the one hand, due to their immunosuppressive nature, they could cause us to have increased susceptibility to other diseases, right? If my immune system is compromised, I'm at higher risk for other disease taking hold. We all know that. That's basics of science. However, he's claiming that further research could provide opportunities to treat large numbers of clinical disorders, right? So we're looking at, is marijuana a positive or a negative? And I'm telling you, the question is still out. We don't know. We know more today than we did 2 years ago and 10 years ago, but we don't know the answer to all of the questions. Now, we need to take a look at terpenes because terpenes also have something to do with this anti-inflammatory action. And besides the THC component, terpenes are gaining a lot of attention because they're looking at the synergy of what terpenes do to help treat pain, depression, anxiety, and fungal and bacterial infections. So now when we're talking about research and what the medical use this herb has, we are also looking at the terpenes. And this chart, I'm just going to talk about a couple of these, but this chart really talks about, we know about terpenes, we just haven't really talked about them in this way. For instance, the third one in on the top, camphene. That's, when I grew up, my mom would put camphophenique on any of, we got a cut, a scrape, a bruise. And so we know the properties of this. They're already, it's an antioxidant, it's an antibacterial, or limonene down here in the lower left, right? That's lemon, that's a citrus, and that has already, that terpene, whether it's in cannabis or not, has already been shown to have anti-anxiety effects, anti-inflammation effects. Some of these, the pinene, that's a very piney smell. So any of you who are into essential oils, you understand this. This eucalyptus, this is essential oils, what they do for us. And, I have an essential oil that I smell before I go to bed at night, right? Because it has calming effects. And so we already know a little bit about this terpene science, but now we're just looking at it, how it affects within the cannabis plant itself. And this is a research that came out just in 2018 comparing CBD, okay, not THC, just CBD, to the terpenoids in the body. And they were looking at it both in vivo and in vitro, and that they did find the conclusions, without going into all the research of this, that the oils exhibited anti-inflammatory properties, right? Okay, both CBD and terpenoids, anti-inflammatory properties. But I like the bottom point. None of the essential oils was as effective as purified CBD. And I can tell you, I use purified CBD as an anti-inflammatory. I have tennis elbow that I get, and I rub it all up my forearms and in my hands and my fingers. I'm recovering from a major breast cancer surgery, so I use essential oils, and the purified CBD oils, I use them on my scars. I use them for pain and inflammation. So I can just say, personally, I believe this, and I use those types of products. Now, I have to bring this up because this, particularly in our dental world, this like blew up our world. And this was the health effects of cannabis and cannabinoids. And this is where the Academies of Science and Medicine took over 70,000 plus research articles and put together this report. You guys can look that up. You can go online at thenationalacademies.org. And it's a very long report that talks about what we know about cannabis and cannabinoids. And one of the notes of the study is that cannabis was effective and is effective in reducing pain, improving muscle-related spasms, and preventing nausea and vomiting, among other benefits. So while there's risk and dangers to cannabis, and particularly marijuana, that is true, there's also rewards. And that report will tell you a lot of the risks as well. So again, we have to look at the differences between THC and CBD, because when we're talking about cannabis, it makes a big difference of what we are talking about. THC helps with some things like appetite, anxiety reduction. CBD is known for its pain-reducing qualities and its anti-nausea qualities. So THC, that's a psychotropic part of the plant, tetrahydrocannabinol, cannabinol, and it is this chemical that makes you high. It works mostly in the brain. They're associated with thinking, memory, pleasure, coordination, time perception, right? THC attaches to those receptors. So you've seen the funny movies or the jokes about someone who's high and they forget what they're doing or where they're going or what they're talking about. That's because the time perception can be affected by THC. But also pleasure, memory, all of that. Positives and possibly negatives. Then you look at the non-psychotropic CBD. It's an antipsychotic, it's an anti-nausea, and it's an anti-inflammatory. And the medical community is particularly excited about CBD and many of its therapeutic effects that it has for people. So it's important to remember what is the difference. And I'm not making THC to be the bad guy here. I'm just saying you have to know the difference. And like I said, sometimes with medical you need both. With CBD, though, it's everywhere. You guys could Google cannabis products right now on Amazon, and you get pages of CBD products, from gummies to tinctures to oils to lotions. They're putting CBD into everything. Even Pepsi-Cola and Coca-Cola are looking at, should we put CBD in our products, right? I can go down to the grocery store and buy CBD-infused water. Now, a lot of it's marketing. Do I believe it's going to do anything? Well, no. I want to know the concentration. I want to know how much CBD per ounce, etc. But it's everywhere. So I like to know in my audience, have any of you used a CBD product? And if yes, what have you used it for? Sleep, localized pain, anxiety, or no, or you don't know, right? Hopefully you know if you've used it. I'm getting don't know, yes, no, yes. Localized pain, yes. Yes for pain, right? Yes for pain. Yes, neck pain. So, yeah, a lot of us are beginning to experiment with these CBD products, and I actually would encourage you to do so. I use some of them every single day and have seen a really great reward for me. I use them at night when I want to calm down and get ready for sleep. I use a pure CBD oil. I use them throughout the day. I take usually a gummy after lunch, just for anxiety, just to calm down, get me through. Okay, what else I got to do today? And of course, localized pain. Now, when we're talking about cannabis in general, THC and or CBD, how do people partake of it? Well, there's basically only 3 ways, and that is topical, as evidenced by this salve up here. Topical, it's an oil, it's a lotion that you rub on. Or edibles, right? Edibles are everywhere, whether that's candies, gummies. People will use marijuana and use the oil and bake with it. Pot brownies was always like the the historical way that we thought of people using edibles. And then, of course, there's the inhaling, whether the inhaling is through a rolled up joint, through vaping. Those still are the 3 main ways: topical, edible, inhaling. And for us in oral health, I know this inhaling piece is the thing that most alarms us because of our historical understanding of inhaling even cigarettes and how it can affect. Nicotine can affect the mouth. And I'm not going to go into vaping, which we could do a whole course on that, but usually vaping is inhaling with an oil, heated up oil. Now, why do people choose different ways to partake? Why would you always just choose oral, right, or edibles? Why? Because look, with inhalation, the onset is almost immediate. And the duration will last up to 2 hours, maybe not, depending on the dosage that you're taking in. So someone who wants to feel better immediately or get relief immediately, or whatever it is that they're taking the marijuana for or the cannabis for, they're going to want to, that's why they want to inhale it, okay? Oral takes longer, right? The onset is longer. So if you're going to have a gummy, it's not going to affect you for 20 minutes to an hour sometimes. Depends on your own body and your own system. Because remember, if you're taking oral, of course, it has to go through the digestive tract, where inhaling mainly goes through the lungs and or through the microvasculature of the mouth. And so oral also, so if I'm taking a CBD oil to help me go to sleep at night, I have to remember to take it, right, 30 to 40 minutes before I think I want to go to sleep. Because although I take it under the tongue, so as you know, that's a much more immediate uptake than going through the digestive tract. It takes a little while. And then oral, the duration is longer, can last 6 to 8 hours, right? So some people get in trouble because they take oral, they go buy the gummies or they buy a chocolate, and, they take one and they don't feel anything, so they take another and then another, and then an hour and a half later, it's all hit at once, bam, and they're like really high, right? Now, the good news is we don't have any reports of anyone ever dying from a marijuana overdose. You'll just get really sick if you take too much. So we got to look at the oral health considerations because that's the industry we work in, and I talk about this even if I'm not talking to dental, because this herb can affect us orally. And in our world, we're looking at caries, periodontal disease, xerostomia is for sure high risk of xerostomia, and oral cancer is very low. We don't know enough yet. We don't know enough if people who take cannabis and smoke it are going to have the same risk factors of those who smoke nicotine. We don't have enough research on that. It makes sense that it would affect the oral mucosa similarly, but we don't know. We do know for sure caries, and xerostomia risks are higher. And we're going to talk about that a little bit. This was the Journal of Periodontology report that came out in 2017 after that large 70,000 plus article report from the national academies. And we saw this kind of everywhere, and this kind of blew up in the oral health world. And the research they did was on frequent recreational cannabis users, or FRC. And this was self-reported, okay? These are people who self-report. So they had to say, yeah, I self-report, I'm a frequent user. And I think frequent was like at least once a day. And so then they did this whole research, but they measured pocket depth, clinical attachment loss, and the results were, of course, that frequent recreational cannabis use is associated with deeper pocket depth, more clinical attachment loss, and higher odds of severe periodontitis, okay? So this was kind of a groundbreaking research that came out in our industry a few years ago. And why would that happen? Well, I like to talk about two of the main symptoms of cannabis use is cotton mouth and the munchies, or xerostomia, dry mouth. It's very real. The munchies, what is the mechanism of action? People want to, when they take THC, they want to eat salty, sweet, fatty, carbohydrate-rich foods. Whoever, right? Whenever you use the THC, now notice how I'm saying THC, not CBD. Anytime we consume any drug, right, it gets distributed everywhere. So when the THC enters that part of the brain, affects mood, stimulates euphoria. It also reaches the part of the brain that influences our appetite. So when you are taking THC, your appetite is going to be stimulated. And also, it promotes the release of the hormones which stimulate hunger. So first of all, your appetite is stimulated, and then your hormones are released that make you think you're hungry. And so when people are high or using marijuana, they want to eat, and they want to eat the sweet and the salty, crunchy, nummy foods, right? So that's a little bit of how it happens. It's just the mechanism of action of the THC. But I want to say that remind ourselves that even the munchies, there's an upside, right? There are many patients who need appetite stimulation, whether they're in chemotherapy, they're HIV patients, and so, it works on our olfactory processes because THC does stimulate the appetite. So I just want to, do the yin and the yang, the positive and the negative with this. And then how does dry mouth work? Well, we know that our saliva is made from 3 glands, and the submandibular gland, down here under our chin, kind of, the submandibular gland is responsible for producing about 70% of all of our saliva. So when the THC is in the binds to those receptors in the brain, it blocks saliva production to the submandibular gland. So it's actually a physical action where the receptors are blocking the production, right? So it just tells the glands to stop producing. And that results in the very real dry mouth that people feel when they're taking THC. It affects the glands, it affects the brain, you get hungry, and you have dry mouth, and you probably aren't really caring about your oral health very much, right? So, if we have people in our chairs in our practice when we get back to practicing, what might we do? Well, we want to have their stomia relief products around for them. And you look at their caries risk. You're going to want to have more products available for your patients who might be using. And here's what I think, this bold new world, particularly in dentistry, what are we going to ask people? What do we tell them about cannabis or marijuana? And what do we want to know, right? Like, I feel like a couple of years ago when I was talking to dental professionals, they were like, oh my God, we got to put cannabis on our medical health history. We've got to find out, what are they using? What are they using it for? Now, those things might be good if you have a relationship with a patient that trusts you and is going to tell you that. But we could just have on our medical health histories, are you taking any drugs and what for? Whether they're prescribed or legal or whatever state you're in, maybe non-legal. They're probably not going to tell you that. But where I live here in Oregon, it's legal for me. It's just as legal for me to light up a joint as it is for me to go into a bar and get a glass of wine. So we have to look at our bias and just have to, do we want our patients to trust us and tell us? Yes, we do. We want them to, because maybe they're in pain and we don't even know that. What else is happening in their life, in their medical history that we might need to know about? I think, particularly in dental, we also want to know this. When is it appropriate to reschedule a patient for treatment? Right? What if they come to the office and you don't know if they're high or not? You don't know if they've used or not. Well, it's much like any other drug, whether that's alcohol or heroin, right? If someone comes to your practice, to your operatory, and they're high, they're exhibiting some kind of symptoms, whether their pupils are dilated, they don't quite have the balance they had, It's just like, are you under the influence of something? And so we have to use our common sense here. We can tell many times, and sometimes you can't, but which procedures are not okay for the patient who has used marijuana? I have a dental friend. He's a dentist in Portland, Oregon, and he has 65% of his patient base are marijuana users. And so he does have a discussion with them, but he has not seen any, in his practice, contraindications. They usually don't come high. They usually will come like having some CBD for pain. If the clinician goes over important information during the appointment, will it be remembered? I don't know. If you have a highly stressed patient, do they remember what you say? They don't always remember our patients. Can a patient give consent? I think that's the most important question. Can a patient give consent to treatment when they have been using? Again, the question is, what have they been using? How long ago, right? If you have a patient came in who smoked marijuana 30 minutes ago, it's still in their system, but it's not at the peak. Remember, marijuana peaks really fast when you smoke it. If you have a patient who had half of a chocolate bar with marijuana 30 minutes ago, it's just now hitting their system. So it's really hard, right, to know where are they, and is it our job to know where they are? It's our job to explain to them, and as long as we are operating in faith and we don't see any signs or we don't think they're under the influence, then we proceed as normal. This is a whole new world, and we have more questions than we have answers, and we're not going to know these answers for a few years. But I want to talk a little bit quickly here about what's happening with CBD in dentistry. Remember, THC, different from CBD, and there are some research is going on. They're looking at terpenes. There has been research that was produced in the Journal of Medical Microbiology back in 2015, where they're looking at terpenes in cannabis, and they're looking at antibiofilm potential against streptococcus, right? We already know that terpenes can help the body destroy bacteria, detoxify, and so they're looking at these essential oils in vitro from the cannabis, and they have discovered one has an antibacterial quality against strep mutans, okay? Against strep mutans, the very bacteria that causes caries. So there's infant research happening in dentistry with CBD and the terpenoids. Remember, THC versus CBD, very different how it's going to respond and the symptoms that people are going to have. And I just wanted to, these are some of the products I use on a daily basis. I use that relief cream up there for any topical pain I have. I have a 500 and a 750 ml bottles of pure isolated CBD oil. And I use those for the sleep. I use those for stress. I have these HempWorks fruit gummies. And each gummy has 10 milligrams of CBD in it. And each of these products also will tell you how much CBD is in it. And that's how you know you're getting a good product. So I like to tell people, because I talk about cannabis a lot, and they say, well, Kelly, if I can get it on Amazon, how do I know? How do I know it's a purified product? And so I always introduce you to HempWorks Lab, because they do third-party testing. Their cannabis plants are organically grown in the United States, and they're a good company to look into. So if you'd like to know more about that, let me know. I am an affiliate with them, and I can help you navigate if you'd like to buy any of their products. It's right here, hempworks.com/Kelli Jaecks, if you want to know more about that. But so that's all about the CBD. They only do CBD at HempWorks. There's no THC in their products. And they also have pets. If you're a dog lover, they have CBD for your pets, both the oils and the snacks. And the other company I want to tell you about that's happening in dentistry, which is really exciting, is this Life, L-Y-F-E-E. It's pronounced Life. You can go to life.com. Here is a live link here, which we'll send out to you later. I'm also an affiliate with this company, and it's the only company I found in the United States where they're taking a CBD mouth spray, so a xerostomia hydration spray with CBD in it. Okay, so what does CBD do? It helps us with pain. It helps us with inflammation. So not only does this mouth spray have xylitol, organic aloe, organic avocado oil, it also has CBD oil. So this is to me amazing. I think we're going to see more and more of these products come out. Now, whether they do what they say, you know, it's a wild, wild west out there. There's no FDA approval for any cannabis products. However, this life, I've talked to the orthodontist who owns the company, the lab, Higher Labs, H-E-I-R Labs, and their lab is completely FDA approved, which that means every product that comes out of their labs has to go through this rigorous testing. So H-I-E-R Labs, sorry about that. So I just like to tell you this is kind of new, what's happening in dentistry right now. You guys they're rolling this out right now. It's just launching where you can buy it and sell it in your office. They have a whole sales plan if you want to have this for your clients. And so before I take all of the any questions that you might have, I just want to remind you, please download your Ultimate Cannabis Cheat Sheet. I would love to send that to you, stay connected with you. Also, want you to know that I have 2 other courses that are just 1 hour, Cannabis 101, Dry Mouth and the Munchies, Cannabis 2.0, THC, CBD, and me. They cover different aspects of cannabis than we've covered today. And if you go to kellyjackscoaching.com, you can buy those, each one for $49, or you can buy a bundle at $89. I'll keep that up for 24 hours for you if you want to know more. If you also want to know more, you know, please know I am a speaker, and I do virtual presentations like this all the time. I'd be happy to provide for your study group, your study club, or your office when we get back to that. Anything virtually in these days, I'm happy to come in and do a cannabis course specialized for you. So wrapping it up, we looked at cannabis, its anti-inflammatory properties, a little bit of how THC and CBD work differently in the body with our receptors, methods of partaking, and some of the kind of exciting considerations going forward. At least I think they're exciting because, you know, I grew up with cannabis was called the gateway drug, and everything about it was bad, right? Marijuana, gateway drug. My father told me that over and over, and even when Oregon was putting it to a vote for recreational, that was the loving conflict I had with my dad, where he was like, that's a gateway drug, we can't legalize it. And I'm saying, my opinion then and even now is let's legalize it, let's tax it, and let's get some use for the rest of the state from this herb. So that's a little bit of what we talked about today. Here's how you can get a hold of me, and I'm willing to take any questions now. Thank you.
Great. Thank you so much, Kelly. That was an amazing presentation. Lots of information there. We've had a lot of engagement in the Q&A, and lots of questions have came in. So I'll get to those. Hopefully we can get through most of them.
Okay.
So Megan asked, how do we balance the positives of CBD, THC with discouraging vaping in young people?
That is a really great question, Megan. Thank you. In one of my other courses, I talk about there's a very big difference between the adolescent brain and the adult brain. And the adolescent brain, all research shows, is really not ready to be taking this drug of THC, right? How do you balance it? It's always a risk versus reward, whether you're talking about any kind of drug. And, of course, cannabis is still considered a drug in our country. So how do we balance it? Really, they should not be vaping. I mean, teenagers should not be partaking of THC. Now, CBD is a different animal, but the psychotropic part of THC is not healthy for adolescent brains. So how we speak about it, how do you talk to a teenager? But it's not good for their brain, and I would encourage them to, just like alcohol, it's not good for the adolescent brain. So whatever kind of strategies you're using with your teens or your patients, it's one of those things you need to wait to imbibe in.
Great. And then Michelle asked, what concentrations are effective and safe? She didn't specify specifically, but I don't know if you have any information on certain concentrations.
Well, for example, the concentrations are important even when you're only talking about CBD, or not only, but when you're, no THC. Concentrations are important because, for instance, those drops I showed you, the 500 and the 750 mil, when I got those, I started with 5 drops in the evening. And then, I eventually increased my dosage, and now I do a full drop or full before I go to bed. And the reason it's good to know the dosage. Anytime you're going to buy a product, it should have the dosage on there. If it doesn't, I wouldn't trust the product, right? It should say 5 mils of CBD per serving or 10 mils per serving. And unfortunately, we don't have dosage guidelines. The best guidelines are to start small and to move upwards, right? There's some evidence that CBD oil can help with migraines, and I have a member of my family that suffers tremendously from migraines. So I'm going to have them start on 5 drops a day and then gradually go up. And the reason is because your cannabinoid receptors are getting used to this new product, right? It's kind of like a hormone receptor. If you flood it with new hormones, it's going to have negative effects. But if you slowly introduce it, it's going to be able to have those positive effects.
Okay, and then Cindy asked, what if the patient is underage and they disclose use? What discussion do we have with the parents, either that they're using or that it's contributing to oral health?
First of all, I think you can have a very honest discussion about oral health, because you can ask them, well, is it marijuana or is it just CBD, right? They'll know. And then you can say, well, what I've learned about marijuana is gives you the munchies. You find that you want to eat these things, and how about brushing your teeth? You stay on your oral health hygiene education, right? If they're eating more simple carbohydrates, they're at higher risk for caries. We know that. And they're at higher risk even for periodontal disease. So I think it's well within our rights, of course, to stay within our oral health education. You could, of course, the thing is, if as oral health professionals and any medical professional, if we shame our patients, right, or you should not, that's bad, those patients are not going to talk to us. So it's better, just like any education, you have your open-ended questions because you want you to be a trusted medical professional for them. So that's how I would go about it. Do you tell your patients, their parents? Well, it's not like abuse where we're mandatory reporters, right? So I don't know. I would take that on a case-by-case basis, personally.
Okay. And then someone else asked, do you see a role for CBD in our practice to calm patients with dental anxiety? Are there limitations in private practice? Are there use limitations in private practice?
I love that question. That's thinking outside the box. Yeah. I do think CBD is a very good adjunct to help with anxiety. However, what I just said a little bit ago, how are you going to give it to them, right? Are you going to dispense, or how would that work in the practice? Right now, the only dental thing I know about is Life, and that has a little bit of CBD oil, but that's not going to calm the anxiety. I think there's nothing wrong with talking to the anxious patient and saying, here's some of the options for you. Personally, I would much, this is my bias, I would much rather take a CBD gummy than any kind of opioid to calm my stress. So but I think that question that you just asked, that's the kind of questions that are going to come forward in the next 5-10 years, because we're at the infancy of understanding how it works. But does CBD help calm stress if you use it over time? Yes, it does. We have science that says that, and we have tons of anecdotal evidence as well.
Awesome. Thank you. And then one last question. Tiffany asked, does THC cause arrhythmia?
Does THC cause arrhythmia by speeding up the heart? Yes, I suppose it could. You know, THC in large amounts, you're going to get sick, and that sick could be affecting the heart rhythm. That's about all I can tell you about that. But THC even is useful in anti-anxiety. I did want to say one more thing though about CBD, and that part of the question was in the dental practice. And here's the thing. THC is marijuana. It is still considered Schedule I drug, okay, federally. So that is off the table. We cannot be prescribing, or, well, we don't prescribe, but we, advocating. We have to be very careful. And then CBD, though, falls under the 2018 Farm Act, which I didn't go into here, but legally CBD, which comes from hemp, it took hemp off all the Schedule I. So CBD that derives from the sativa strain hemp is not Schedule I. Okay, so there's a very different legal action. If you live in a state where medical marijuana and or recreational marijuana is still illegal, pure CBD is legal now because the 2018 Farm Act changed that. So I just want to make that very clear, right? States have the right to legalize medical or recreational, but we still have to remember that the overarching law is federal, and that THC, which is the marijuana part, is still under Schedule I.
Okay. Dr. Cooch, if you're still with us, do you have anything else to add before I go into the wrap-up?
I would just love to tell you, Kelly, that I've sat through several courses on the greening of medicine and dentistry in the last, 5 years. And I learned more from you today specifically about this than I've learned combined in the past. So I applaud you. That was an excellent program. I think that,
thank you.
Obviously, I appreciated we've talked about the CBD in terms of dental caries. That's one of the things we've kicked around. I find it interesting because I think, again, there's a lot we don't know yet. And I find it very curious that there's so many of the cannabinoid receptors in the body. It's kind of almost like, well, what are they doing there, right? So,
yeah.
But you almost have to look back and go, okay, our ancestors somewhere were using this, herb a long time ago. But I find that interesting. I also think that even for us in the state of Oregon, you can assume. I mirror your same story. I had a visitor from out of state who wanted to go buy some CBD oil for his arthritis. I'd never been in one of those a green pharmacy, and it was like, holy cow! There was a world I didn't even know existed, right? And so it was a little intimidating at first. But I think the other thing that we need to all be cognizant of, even in the states where medical marijuana is not legal, certainly your patients, there's a number of your patients who are using it recreationally anyway. So I think that, even if it's not legal, it's still, there's a portion of everybody's patients that are using, THC. So I thought it was a great program. Kelly, thank you so much for taking your time out of your life to spend this with us today.
Thank you. It was my pleasure.
All right. Thank you, Dr. Cooch, and thank you, Kelly. So before I let you go, there's just a couple of things to mention. If you had questions that didn't get answered today, Kelly has, again, included this contact information on the screen, so you're welcome to reach out for more information. You don't want to miss tomorrow's course. We are honored to host Dr. Robert Lustig. He's an internationally recognized speaker and author of 200 academic works and popular books like The Hacking of the American Mind. Fat Chance, Beating the Odds Against Sugar, Processed Food, Obesity, and Disease. He will be presenting on the 3 presentations of metabolic syndrome and how dentists can reorient dietary practices. We could really go on and on about his accomplishments. It's definitely going to be a privilege to hear him speak tomorrow. For today's course, we're posting the recordings in the group, in the Facebook group, and also emailing them each day with CE info. For CE, once you complete the quiz and evaluation form, you'll get your certificate within 1 to 2 weeks. All right, that takes care of everything on my end. We hope you all have a wonderful day, and thank you so much for joining us.
Bye-bye, everybody.
Bye. Thanks so much.